You're welcome back. This is Newsfile. It's your most authoritative news analysis platform. And we are canvassing for you first the issues about the coronavirus infections in Ghana, and then the matters of whether or not the country has peaked and was expected to begin a decline. Then the 3,000 and so suddenly hit 4,000 plus, and people are beginning to ask questions, and we are getting very good explanations as to what is happening. Let's go back to the phone lines and get our experts to assist us further. We go to the Zoom and get our experts to assist us further. Now, Dr. John Amuasi was giving us this explanation and then came to the question of the numbers that were that brought the update to 4,012, and we are told that this was a case where over 20% was as a result of an outbreak in an industrial facility with 1,300 workers, out of which 533 have been confirmed positive. 533 have been confirmed positive. He says this is a reflection of the reality in our communities. What does that mean? And what is expected from this kind of discovery? Dr. Amuasi.
Hey, thanks for that, Samson. I like the way you journalists are able to latch on to stuff and, you know. but no, that statement, yeah, it's an important statement I made there because of a couple of things, and I'll explain. Now, if you look back at this epidemic globally, we had the concerns with the Diamond Princess cruise ships that had infections aboard. And the Diamond Princess cruise ship was that one place that helped a lot globally to establish some estimate of what their reproductive number was. This was because you had a well-defined, not only well-defined, but also a confined population within which you could measure the spread of the disease and even map out the levels of mobility and so on. We have seen this kind of picture also repeat itself and be used in other places. For example, in the US, at the meat packaging plants, Tyson meat packaging plants, where you had in some plants over 14% of the workers, coming down positive with coronavirus. There are three places where we tend to aggregate and associate very closely for a relatively long periods of time. One is at home, the second place is during our commute, and the third place is at work. So if we now have data which shows a fairly well-described population, which is a population of factory workers in an industrial site, over 1,300, I thought it was 1,500, but he said 1,300 plus, and we have 533, that is well over 1/3, falling ill. It should tell you what the reality of exposure and risk of infection is. And you can use that as a fair proxy of what the rate of spread would be within a community when there's one infected person. All you need to establish among those factory workers would be how many people were initially infected, who was the index case, or who were the first few cases. And then you look at the amount of time they spent together and the proximity they had with each other. And with that, you could even measure what your real rate of spread is. So I think this is really indicative of the reality. But I need to throw in a caveat there. The good thing here, again, is that this has been picked up quickly. What that means is that we know these people, they'll be isolated and they'll be treated. So it should not surprise you at all if the mortality from this now cohort of factory workers will be zero. And that's exactly what you want. You want to be able to detect your cases early, quickly. This is exactly what Germany has been able to do. And so far Ghana is doing, but we need to change the gears quickly. Germany has just as many infections as France. And yet less than 1/3 the level of mortality, or barely 1/3 the level of mortality as France. What is making the difference? It's the rate of testing, which allows you to detect very quickly and therefore to intervene among those who are positive. And remember, a greater majority will be asymptomatic. So it should tell you that we need to now move into a mass testing regime. I'm not in a right position to speak about our capacity to do that, but from what I understand, this is being worked on to increase the testing capacity. We have even developed in-house antibody antigen reaction test kits here at KNUST, which are being tested by the FDA. I don't know the outcomes of that. So there's a lot of activity around this. I don't know the full detail, but this is where the pressure should be put, because as for the rate of infections, it most likely will go up, and therefore you need to continue with the things we've talked about, the hand washing, the mask, and so on and so forth. But that only takes you to a certain point. But let me just go back to my main point, which was that yes, the picture that we saw in the factory is a reflection of the reality.
So let me bring in Nana Kofi Quakyi here. That sort of mass numbers, so to speak, in that test, over 500 confirmed. What does that tell you of what we expect to do or what we should be doing going forward?
Well, again, the good thing is that we've detected that this cohort exists and that we are taking steps to identify them and to make sure that they're isolated and being treated. The thing that is quite clear from that is that these workers don't live at the factory. Exactly. They live in their communities. They have households, they have family members. And so it speaks to now a question of how aggressive and effective are we going to be at contact tracing. If we let up and we're not able to effectively follow up and track down all the contacts, 500 as a seeding reservoir is a big, big number. And we need to make sure that we're able to aggressively go out and identify all those contacts, trace, and test them. But again, it does speak to, like Dr. Amuasi said, what is going on in the communities, the risk that actually exists in the communities. Because I would guess that the first case there is not somebody who traveled and came in. This is somebody probably who got infected in their community, took it to work, and it spread there. The idea that it has only happened at one place in the whole country, that's a little naive. We have to be honest with ourselves about it. And because of that, it's important that we begin to really get out there and attempt to estimate the extent of the spread. This is something that I think a lot of academics, a lot of researchers, a lot of independent-minded people have been saying from the beginning. Our testing strategy cannot be limited to just contact tracing on hospitals. We actually have to do an active, pretty wide-scale epidemiological study of what's going on in the country with regards to COVID-19. The rapid testing kits are really helpful there. It will allow us to really, what they do is give us a sense of people who have previously been infected or people who have late-stage infections. Then we can actually get a sense of where we stand. But
beyond enhancing the testing, are there any other things you have expectations should be done, because this may give an indication of the reality in the community infections?
Well, yeah, so it's not just a question of enhancing the testing. It's about doing an additional type of testing, which is community level screening, where we are doing a survey to figure out exactly what the extent of spread is. That's not just about enhancing. It's almost a different type over there. All right. But obviously, with regards to the actual strategy we're using right now, our contact tracing, that has to be absolutely impeccable right now. The room for error is really small now, right. And it's important that we really check those boxes.
Okay, give me just a minute. And Dr. Amuasi, there are people who have expectations that because of the rise in the numbers of infections, the state should be rolling out some, stiffer, protocols again. There are some who are even thinking that maybe some lockdowns may have to happen again.
No, thank you, Samson. It's really difficult to tell what will happen, and let alone what must be done. And I don't envy any leader or any decision maker at this time.
Yeah, what do you recommend?
Because of the gravity of the situation. And it's even more difficult when your vision is limited. And so you need to take very long decisions with long-lasting implications based on a limited amount of information. Now, that being said, I need to emphasize that the number of infections or the infection rate going up is not so much the issue for alarm, but our ability to quickly detect these cases and putting measures to treat them.
Okay.
So far, we've done right with this, and this is why we have a relatively lower mortality, even though we have much more cases, which is only to be expected. So having more cases is not the sole indicator for decision-making around restrictive measures. The restrictive measures are also a function of how much time you need to buy.
Okay.
Most of the restrictive measures that were put in place globally were largely because there was a need to ramp up hospital capacity. So you saw, stadia being converted into health facilities all over the world. You saw the mass production of ventilators and PPE and this kind of thing, because what you really want to do is to buy time. Now, when you have bought that time and you have what it takes to take care of those who are ill, then you can lift the lid. Now, when you lift the lid, you must be clear with everyone and say, hey, I've lifted the lid, take all these preventive measures on your own and so on and so forth, but the number of infections will go up. Nonetheless, we're ready, we've got you, we're going to take care of that. So if we have put in place all that we need to, we've ramped up our hospital capacity, our ventilators, and PPE and all that, then I would say don't rely only on the number of cases going up. Certainly don't tell people the number of cases will go down, because that's not true. And don't alarm them and say that everyone is going to die, because that also will not be true if you've put in place the right kind of measure.
Our place of some amount of safety and assurance, and our ability to now grab a hold of the disease by way of being able to isolate and test, is when we get close to, or we get to near real-time results, daily testing, and getting the results on a daily basis. Is that not so? When do you suspect we will get there?
No, Samson, you got that spot on. I mean, obviously, I cannot speak to when we will get there. This will be something that will rely directly with the Ministry of Health and the Ghana Health Service to speak to what we have done. What I can tell you is that there are a good number of facilities, research facilities and other facilities in Ghana which have the equipment that is needed to carry out the test, which is the PCR machines. There's also talk about the use of the machines that are used for the TB testing, which is called the Gene Expert, which can be repurposed for COVID. And these are almost in every district hospital. The tricky part is when you have a sample and you need to what we call inactivate the virus, you need to do this under special conditions. You need a special hood for that, or you need what we call a glove box. This is what we do not have in large numbers. I cannot tell how many are being brought in or the activities around ramping that up. So I cannot speak to it directly, but what I can say is that the testing machines in themselves, we have a lot in Ghana, and a lot of effort is being made. Even research institutions like the Crop Research Institute is actually working on repurposing some of their machines to be able to do COVID testing. But what is needed would be things like this glove box and the hoods.
Great.
So we ought to do this. I can't tell to what degree we've arrived there. I think you should ask directly to the Ministry of Health and Ghana Health Service.
We can't thank you enough once again, but like I indicated earlier, what will be your mask wearing protocol? In the course of the week, I have joined webinars, international and even national. I have seen speakers who are sitting in their rooms alone, in their offices alone, doing, a discussion on a webinar on Zoom and having their mask on. When do you wear yours? Why do you wear yours?
Samson, you asked a great question. And I think in public health communication, it's important to include that aspect of demonstration. And it's also important to recognize that not everybody will be able to appreciate, or we have varying levels of appreciation of the science behind some of the recommendations that we make. A good example is, and maybe I shouldn't go there. I'll change my mind right there. I could get into trouble with my breastfeeding experts. Okay. So I will not go there. But for example, wearing the mask is meant to protect you from possibly inhaling or getting the virus into your mouth or your nose. And also, if you have it, giving it to someone. So if you are on your own, obviously there is no one around you. So one could argue that there's no need to be wearing a mask. But the question is, if I'm using a common space and I'm not wearing my mask and I'm alone and I'm speaking like I'm speaking to you, and I have, some droplets falling all around the surface, and I leave, and someone else comes and sits down and has their hands all over that surface, I'd have invariably spread the infection. I may have been alone while I was in that room, but because I did not wear a mask, I have ended up spreading it. So it is not just about being alone or being with people that need to wear a mask, but trying to really understand what the risks involved are. So for me, my recommendation would be that the blanket one would be to wear a mask as often as you can. Certainly when you are in public places, whether you are alone or not, when you are using public spaces or facilities, whether you are alone or not, and by all means, when you are in the company of others. Okay. Some maybe are taking it very far to even wearing face and nose masks at home. And I congratulate those who are able to do that. I'm not there yet. But it's important that this understanding about the use of the mask comes across very strongly. So what I would say is use a mask even if you're alone, if you're using or present in public spaces or public places. That's what I'll add to what is out there.
Thank you very much, Dr. John Amuasi, the KCCR. And let me get to Nana Kofi Quakyi. So Nana, when do you wear your mask and how do you wear it?
For me, quite honestly, anytime I'm leaving home, I always make sure that I have it. Obviously, sometimes, it skips your mind, but what I do instead is I have my, fabric ones, and then I have in the car at all times a couple of the single-use ones in case I should forget. But anytime I'm going to any place where there is any chance of circulated air, going to buy groceries or anything, I'm going to wear the mask. Anytime there's a chance I'm going to interact with people, I wear the mask. And one of the things I try to do as much as possible is to always carry hand sanitizer with me, even when I'm wearing the mask, so that if it gets uncomfortable, I need to adjust it, I can clean my hands properly before I actually touch the mask. Okay. and try and fix it.
Do you wear your mask?
So that's basically my methodology.
Do you wear your mask when you sit in your car alone and you are driving to some place, or you get to the point where you need to engage in some service before you wear it?
Well, what I try to do as much as possible, just to prevent myself from touching the mask too many times or forgetting to sanitize the car or whatever, I just wear the mask before I actually get in the car. And I don't take it off until I get home. And when I get home, the first thing I do is throw it out, wash my hands, sanitize, and then wipe down the wheel and wipe down the gearbox to make sure that in case my hands come in contact with something inadvertently, at least I'm sanitizing the area.
Okay. Do you have your AC on and roll your glasses?
Yes. I mean, I'm still reacclimatizing, so the heat is a problem for me sometimes, so the AC is usually on. Okay.
Thank you very much for all of you for the contributions that you have made this morning, and our audiences are especially thankful because we can be sure that they have benefited a great deal. Nana Kofi Quakyi is a research fellow, doctoral candidate, and adjunct assistant professor at New York University School of Global Public Health, studies health systems, health services, and health economics with a special focus on provider payment mechanisms and equity in access to care. Of course, if you have checked the list that was outdoored by the NDC as its team to advise and assist the government on this process, you'll find his name there. Dr. John Amuasi is lecturer, Global Health Department, School of Public Health, KNUST, and leader, Global Health and Infectious Diseases Research Group at the Kumasi Center for Collaborative Research in Tropical Medicine. Thank you all so very much, gentlemen. Right, so let me come back to the studio now. We will take another quick break, and when we return, we will be engaging on Dr. Baumia and Mohammed's, banter about who is best to manage your economy in crisis. Of course, Kofi Quakyi is here. Dr. Gideon Boako, spokesperson for the Vice President and his aide, will also join us. We have John Abdullahi Jinapo, MP Yape Kushogu, and member Finance and Mines and Energy Committees of Parliament. Before we take that break, Mr. Prosobani, after listening to the experts, what do you have to say?
We are not at anywhere at our peak right now. That's what I picked from the experts.
That's obvious.
And therefore, our Ghana Health Service leadership must revise their notes and come back with more accurate data, facts, and analysis, so that we citizens can go along with their leadership on the management of COVID-19. That's what I would say on that. In addition, I just want to point out a couple of things that came up earlier, which is the way food distribution was done earlier. And I still want to emphasize that you cannot have a humanitarian response without a plan. And from the onset of any crisis, such as this pandemic, if you think through a complete plan, you would necessarily target or note that there will be a consequence of a humanitarian action. And that humanitarian action dovetails the strategic response plan that you have done. So if we, on the onset, project that we will have a humanitarian action as an intervention, then we'll have to prepare whether it's food and other materials to support. But however, all these are not necessarily in terms of having direct contact with persons. For example, when the interventions on electricity and water, they didn't require those type of, they were done by institutions, that's fine. But where you need to do food distribution, you need to have a plan. Then secondly, authoritatively, I mean, I can say from now, from what I'm hearing, that WHO never said what the Honorable Deputy Minister said, that Ghana's plan or strategy was one of the best amongst us or something. That is also incorrect, and we're waiting for the WHO to come. And I think that some of these statements and utterances is a factor of confidence building.
Okay.
In crisis, without confidence building measures to bring along the citizens, the whole architecture of the response is questioned. And therefore, we'll have checkered approaches to knee-jerk responses to things as they emerge. And I think that we have to look at that. And then another point is that this thing is not about politics. It's not about government and opposition, but it's national crisis we are confronting.
Okay. So
when we make recommendations or interventions, it's not a critique. It is a submission of some opinion or points that should be considered or analyzed further and dealt with. It's not a matter of...
all right.
So we need to bring this national approach to the crisis. If we divide it, the recipe it's going to be a failure.
Right.
We have to listen to all voices to ensure that we get this right. Finally, something, let me come on. We need to listen from the experts. We need to be cautious about community spreading. That is where the danger is. And I think we are gradually getting there. If we don't arrest it, the consequences cannot be properly managed.
Thank you very much. Of course, from what we are gathering, there's a huge, spread potential in the general population or in the community, and clusters like what we are hearing from this industrial, place, if certain measures are not taken. But what will be the measures? I'm sure that apart from what the doctors and the specialists, experts are suggesting, we will hear from the president what will happen tomorrow. Yes. So, Quakyi, you give us 1 minute of your conclusions, having listened to the experts.
Well, listening to the experts, I think it is clear that looking at the infection and mortality figures, that Ghana is doing something right. It's important that we commend those who are doing this. Of course, criticize where you have to. But where people deserve commendations, let it come from us as well. Let it not come from other commentators. And then in the name of contributing to the efforts of the state, all you can do is to say the very things that are not positive about our efforts. And then, Samson, I think it is important that we comment also on the statement by Dr. Bedu-Sarkodie. And if we go back to his response, which didn't appear when you played it, he was talking about a backlog of tests that had to be done. There had been a huge backlog. On the 25th of April, the tests that were done produced coming from the samples taken that day, produced the highest. And then subsequently, the tests that were done on the various days were coming down, which was reflected in the graph that was shown. So that his advice was that if we observed the social distancing requirements, we probably would have that as a peak. And the peak that he spoke about, that is what it referred to. I do not think he was suggesting somehow that Ghana, we are there, and therefore we can relax our guard. That is what I see. But in summary, all I can say is that we are in this fight together, and the work that is being done by especially our frontline health workers has been commendable. We urge them to continue. We should continue to even pray for the leadership of this country, that they will have the wisdom to make the right decisions, that in the end, Ghana can confidently say, as many are saying of us, that we did handle this as best as we can.
Okay. Thank you very much. We take a break. When we return, we will deal with President Mahama and Dr. Bawumia, the Vice President's, banter about who is best placed to manage your economy in crisis. Dr. Gideon Boako and John Jinapa will join us, and then Kofi Quakyi makes a return to look at the IMF figures. Is there something to be concerned about?